All right. So we're going to understand a little bit about ADHD. How does it manifest in adults? How do we manage symptoms? What are the treatment options out there? And how is it diagnosed? How do we approach the doctor? What do we do if we suspect we have ADHD or someone in our family does? And that's what we're going to discuss. So before going into that, let's understand ADHD a little bit. ADHD, the abbreviation of attention deficit hyperactivity disorder, is, I'm sure we all have heard about it, generally very, very commonly diagnosed in children. So the thought behind it, it is a neurodevelopmental disorder, which means it develops in your childhood. And it comes with triad of symptoms of inattention, inability to focus, and other symptoms, hyperactivity, and impulsivity. So these are the three main, it's like a syndrome of all these symptoms. It typically, like I said, begins in childhood, and they're treated. If they're not treated, then this leads to a very misunderstood, disorganized, messy adult who is struggling at work, who's struggling with parenting because there are too many responsibility, struggling with deadlines, frustrated individuals, and also struggling in relationships. So it's kind of impacting a lot of their life areas. That's how they present. So let's look at some numbers. If you look at the childhood diagnosis, how prevalent it is, it's around 4 to 12%. They're diagnosed in childhood, and they continue to have those symptoms, and they remain treated even as adults. So 50% of the adults, they still have these symptoms, even though it started in childhood. Roughly the number 6% of adults right now in the US are diagnosed with ADHD, and that is like 15.5 million. That is a lot. And if we see in terms of gender, like how are they diagnosed? In younger people, it's more males than females, but as they grow into adults, the number becomes equal. And we will talk more about it later on. Looking at the risk factors, the environmental factors that could subject you to develop ADHD as a child, preterm birth is a big factor. Other than that, drug use, while maternal drug use is a huge one, especially alcohol. Maternal smoking is highly associated as well. Some kind of hypoxic injury during birth, exposure to toxins like leads, and having family history or history of head injury. All these factors make you more susceptible. There is a huge association with genetics as being one of the biggest causes. It's highly inheritable, around 70% attributable to like genetic cause. If a sibling has ADHD, they're 2 times more likely to have more than the general population is the number. And these are the other environmental causes that we just discussed. So let's look at ADHD in women. It's really interesting. So girls usually generally most of them present with inattention. And boys mostly present with a lot of hyperactivity, disruptive type of picture. So generally, more boys are more likely to be reported or referred by parents and teachers for diagnosis and treatment. And usually girls fall through the cracks and they remain untreated until it starts becoming a problem. Generally, ADHD is diagnosed before the age of 12, but you'll see that as age goes by, high school becomes more, difficult. Tasks becomes more difficult, and women with ADHD then start, or girls with ADHD start getting diagnosed, and that's why hence the number, why it is like 2:1 in younger age, and then it almost becomes equal when they turn into adults. Usually they refer themselves if they find out that they have, symptoms of ADHD. And in general, it really impacts a woman's life. Why? Because women have the responsibility of, work, house responsibilities, a lot of things in their life, and they're not able to juggle through it effectively. And that's how it becomes very prominent. There are also very interesting studies which connect estrogen with ADHD. Lots and lots of studies out there. Generally, in a menstrual cycle, they found that the time of where the estrogen level, fell and were low, the ADHD symptoms were more severe. Like clinically, it means like tweaking the medication, but the strong relationship also kind of tells us through life how ADHD is more than common and can happen a lot in women as well. I just wanted to have a look at this too. So let's look at the ADHD brain. So typically, a normal brain and a person with ADHD, as we can see, it affects different parts of the brain. So ADHD presents like a syndrome. So yes, different parts of the brain doing different things are affected. For example, the prefrontal cortex, which has to do with decision making, attention. Studies found that those parts of the brains in the prefrontal cortex were thinner than other parts of the brain. Other than that, the basal ganglia, the reticular system, the limbic system, they're all affected. And all studies, CT scans have found that they're a little bit underdeveloped and thinner. In the practical aspect, if we really see in a clinical picture, if you compare, say, a 13-year-old boy with ADHD with a 13-year-old boy who does not have ADHD, you'll see that the 13-year-old boy with ADHD, they're a lot more emotionally immature. The decision-making capacities are not up to the par of a 13-year-old. They're a lot more irrational. You'll see that, and that's because their brain is actually, maybe calculatively, they say give an average of 2 years as a standard number, but they're 2 years behind than their peers. And that's why they appear immature if you compare. And this is across the age limit and the age range. So let's look at some signs and symptoms. How do they present? And I will keep definitely adult in perspective. So so if you have 6 or more of either inattention or 6 or more of hyperactivity symptoms for at least 6 months, then you're you're eligible to be diagnosed with ADHD. And some of the symptoms that we see in these individuals are, first of all, attention span. So you can't focus well. And because you can't focus well, you're not paying attention to details. Because you're not paying attention to details, you're rushing through things, you make a lot of careless mistakes. So that then starts affecting your work at work, where they're working, because you're like missing a lot of details and your work is not as good. You can't sustain the attention, keep focusing. So difficulty sitting through, meetings and stuff, or in lectures, you're like restless, you can't focus for long, and you get up and leave.
This is Dr. Shrestha.
Oh, that's a symptom.
And
please mute yourselves. Thank you. And these individuals, you'll see that because they lose their focus so quickly, these are the people you're talking and then they're looking everywhere. Or you can see that they're not really listening to you. And this really impacts relationship between husband, wife, or girlfriend, boyfriend, or any relationship. Because the common thing is, oh, they're not listening to you. Because why? Because their brain is busy thinking something else. So that really happens because they can't listen or focus for too long. They are not as planned because their executive skills are not that great because of, we just saw like the brain areas, they're not that developed and is behind. So they don't plan very well. And because they don't plan it very well, they're always kind of waiting for the deadline or meeting the deadline. Their work is not completed on time. Everything is a chaos. Handling, juggling different responsibility is really hard for this person. Things get, and then like they're disorganized, they're messy, the children don't do things on time. So you'll see that a lot of the executive functionings are hit, and as a result of which you're a very disorganized person. You also don't like things which are challenging. We see this more in kids than in adults, but I just want to mention it as well. You're losing things, you're forgetful, you're highly distracted. And because you are highly distracted, you are not able to complete your work very well. So these are some of the symptoms of ADHD. Hyperactivity, mostly seen in particularly boys more so than girls, more like in teens and children than in adults, but it can also manifest in a different way in an adult. For example, a person who has hyperactivity as an adult, their hands are busy, they're tapping a lot, they're shaking their legs a lot when sitting and listening. They can't sit still, so they can't sit still, so they have to get up and leave all the time. And they're very uncomfortable sitting still. Some of these individuals are very, kind of driven by things like they're really into sports, especially men. They like high impact, strenuous sports, and you'll see that they're really sporty and, really into running and things like that. And that's how they take out the energy. There's a tendency to talk a lot as well, hypertalkativeness. So that, or interrupting, not waiting. So you're interrupting conversation, you're blurting out things. So, socially, they can offend a lot of people. They don't have a lot of patience to wait for their turn, or they get very frustrated very easily. So anger outbursts, very, very common. So yeah, the impulsivity and hyperactivity kind of like go together, but yes, these are individuals who talk a lot, who interrupt a lot. They answer your questions before you even complete it. There's a lot of impulsive thinking, so you're getting in and out of relationship very quickly. You don't think through things, so you're buying things impulsively. They're more than ready to go and jump into risky behaviors or risk-taking behaviors, and because they can't wait, they have a lot of anger outbursts, and that can be a problem. So these are roughly how they look like and they present in a gist, and this affects different parts of their life. So next, we will move on to types of how they're diagnosed, because some have the inattention, commonly known as ADD type a lot, and some have combined type, and some have hyperactive type. So we generally see that the combined type present the most, and the diagnosis wise that 70% people have combined type mostly. And then comes the inattentive type, 18%, generally again, more diagnosed in women, more common in women. And then 8% hyperactive, more predominantly hyperactive type. And all these are comes in different severity. Some of them have it mild, moderate, severe, based on how it's impacting their day-to-day life. Moving on. So typically, I get a lot of questions. I mean, if you're diagnosed as a child, what is the likelihood that it'll remain in adulthood? Do they need to be treated in adulthood? And generally, my question is yes. It depends. You're treated, you have mild to moderate, you've done a lot of therapy as a child, you've learned how to manage your time. Yes, you can stay, without medication and manage things, but typically the inattention is a symptom that remains and that affects you as an adult. Hyperactivity generally remits, and that has to do with a part of the brain that's involved with the hyperactivity symptoms. There are a lot of studies that they say it kind of the brain grows up to that extent as an adult, and you don't have it anymore. But inattention generally remains, and that's what most people come for treatment for. Distractibility is a little bit hard to treat in general, but yes, a lot of these adults continue to need treatment, some form of treatment, and they choose to do that. So if you have ADHD, what are the steps to follow? So definitely, generally, you would go to a practitioner like myself, a psychiatrist or a psychologist. Different ways of being diagnosed. There'll be a lot of in the beginning, we'll do a physical exam, interview, talk to you, maybe most likely generally talk to your parent as well if you're a young adult. Most of the time, ADHD is very much a clinical diagnosis, so which is the gold standard, and it's all based on symptom report. In children, we generally talk to the school, look at their, report cards, and also diagnose like that. But in adults, it's mostly like the adult presenting. There are different symptom report scales that we have, patients fill out. One of them is called Adult Self-Report Inventory. And then there are others called bars, which is, we generally have the patient fill it, the parents fill it, or if you're diagnosed as having ADHD as a child, you can bring those reports as well. And there are other testing called neuropsychological testing. They're like extensive 3-hour testing. Suppose like clinically, the doctor could not find enough symptoms, didn't see it during a clinical interview, they might ask you to do a neuropsych testing, which basically are a series of tests that, psychological testing that's done to, measure the attention capacity of the brain. And usually you'll be referred out if that's the case. But this is different ways of being diagnosed. So moving on to treatment. So basically, obviously, there's medication and therapy. Typically, ADHD is treated by the special classification of medication called psychostimulants. And there are other medications called non-stimulants, which are also out there for treatment. Both are used for the treatment of ADHD in adults. Other than that, there's therapy, cognitive behavioral therapy, and different behavioral modification therapy and things like that, we will go through briefly. So let's look at the behavioral treatment. So CBT, also otherwise known as cognitive behavioral therapy, it's one of the best and one of the most evidence-based treatment for treatment of ADHD. The therapist helps with, helping the patient tackle issues with time management, planning, how to organize day-to-day life activities, which is impacted by ADHD. Other than that, ADHD also it brings a lot of depression, anxiety type symptoms, a lot of doubting yourself, things like that, a lot of stress. So CBT, cognitive behavioral therapy, helps with that on the side as well. It also focuses on teaching, stress reduction, impulse control, and how to emotionally regulate yourself. And that is usually the go-to. Mindfulness would be the second one. I'm sure we're all aware of the mindfulness techniques like meditation, yoga, other mindfulness activities like art, and things like that. So mindful meditation, a lot of research has shown that it helps enhance specific brain processes, especially like with mood regulation and attention control as far as they're concerned. So a lot of these mindfulness techniques are really, really helpful as well. Motivational therapy is a type of therapy which is it's like basically an interview technique, which helps patients like in the sense, motivate them to change. Because a lot of ADHD is, managing ADHD symptoms is based on changing your behavior. So you got to change the structure of the day. You need to implement a lot of behavior changes, the way you think, things you do. So for that, I think the person has to be ready. And we've seen a lot in data and even in clinical experience, adults have a hard time sticking to that. Adults have a hard time changing or, making behavioral changes. That's why we implement things like motivational therapy, just to get them to make those changes on a day-to-day basis. Occupational therapy is another one. It helps with, setting routine, setting environment and things like that, and really helps navigate those other, the impacts that it's having. ADHD coaching, this is something that's really new right now. ADHD coach is a professional, like they're therapists, they're licensed professionals who actually coach you. It's usually, like timed treatment where this person helps you look at your life, what the ADHD symptoms are, how is it impacting which areas, and then they help you create certain goals, and then they help you how to get to that goals. So that it's this person who's this coach who's helping you develop constructive habits, manage day-to-day obligations and things like that. DBT, another one, dialectical behavior therapy, it has to do with a lot of like distress tolerance, mindfulness, and emotional regulation. Typically, this is used for people who have borderline personality disorder, but because ADHD personalities also have a lot of emotional regulation issues, it has shown to help as well. So it's also used. Neurofeedback, another one. Not a lot of studies really support this, but it's out there. I've had parents and patients come and ask me about it and say the same thing. If it helps you, try it out. There's not a lot of evidence that it's been helpful, but it's out there. And things like art and music therapy also help. So roughly, these are the therapeutic methods in behavioral treatment for ADHD. We'll move on to medication. I will start off by saying that there are really good medications for ADHD, one of the better ones in psychiatry and in psychiatric medications. Usually the first line of treatment for an adult is always a non-stimulant. There's a medication called Strattera, comes in 25 to 100 milligrams strength, typically a very popular choice. And there are some side effects that it causes that listed over here. There are other medications like Wellbutrin, or it comes in the, bupropion or Wellbutrin, that's also used. And there are other non-stimulants like guanfacine, clonidine, typically used in children, but also used in adults to treat adult ADHD. The psychostimulants are the more effective ones. And yes, it is approved, but generally we start with the non-stimulant. There are generally two types of psychostimulants you would see. One is the amphetamine and the methylphenidate, a little difference in how they work on the dopamine, and their target is increasing dopamine or making dopamine more accessible, which increases attention span and stuff. You guys have probably heard the names Adderall, Vyvanse, Mydayis, Concerta, Focalin, they're all out there. These medications are really effective. The effect size is nearly like 0.9. They're very helpful. There are certain side effects that makes them not very, pleasurable or desired. Like it suppresses appetite, it increases heart rate, blood pressure. It's generally used with very caution with people with cardiac history. It also causes insomnia, dysphoria. These are some of the side effects that it can have. But generally, practitioners start slow, monitor everything, and then make changes if needed. So it's nothing to be that scared about. It is very useful, and it's helped people, especially in children. It's really helped change their growth trajectories and really help them tremendously in school. These are the medications that's out there other than the therapy. So it's your choice what you want to do. Generally, that's what I go with. If you have something like a mild ADHD, you could do behavioral therapy and really stick to it and manage your symptoms and day to day. Or if it's severe, then you can go for medications. So if we go untreated, what are some things that can happen? Like I'd mentioned, the amount of inattention, the amount of impulsiveness makes one susceptible. A lot of people, they don't do that well at jobs, and they make mistakes a lot. So there's a risk of losing jobs. In relationship, it affects them, or even at workplace or in public, because they might have a hard time regulating their emotion, have anger outbursts and things like that. And that leads to, I think, burning more bridges with people. Divorce, very, very, very common, because there's a lot of relationship problems, especially if you end up with someone who's completely polar opposite, like, ADHD person with someone with, God forbid, OCPD type of stuff, who are very, structured, There's a lot of clashes that can happen. Financially, it can impact you, because you're always kind of waiting for the deadline. You're not planning, you're not paying your bills on time, so you can have financial downfalls. And in general, the disorganization, the not planning really impacts, I would say, the family in general, because then, the adult is actually managing the child as well. Many times I've had more than 10 times, more than any times, I have generally have had, parents bring their children and also discover that they themselves have ADHD or might have had and seeking treatment. And when they've seek treatment, it's been proven very beneficial for the children, because things then move smoothly. And in a time like this modern lifestyle, like you have to manage everything, and there's stress, there's deadlines. It's very hard for a person with ADHD to survive in a situation like that. So it's better treated than not. Other impacts it can have, a lot of times untreated ADHD individuals, they present with anxiety, depression, and come to know it was like mostly the ADHD, which was the cause. It's really common for an ADHD person to have other diagnosis. And it can also be confusing with some diagnoses like bipolar disorder because of the overlap of symptoms. Also, there's a lot of substance use, marijuana, alcohol, just to reduce the stress. It's been seen, and a lot of studies have shown that if you treat ADHD, substance use disorder has been minimized and lessened, and it's really helped. There are lots of evidence. So these are some of the resources if you want to read more about it. If you want to be emailed or something, please let us know. I will have Asia staff share some of these things. There's a lot out there. There are lots of books about it. It's very common than we think, and not everybody who has a hard time completing tasks or inattention ends up having ADHD. But if you have a pattern starting from childhood, it is okay to go seek help and get yourself diagnosed and get help. It will help you and your family tremendously and really lessen the burden ADHD brings. All right, I'm going to stop sharing the screen and open for any type of questions.